doctor now.
I miss Bear Patrol.
Alrighty.
Oh, mess. Oh.
Has the breast cancer awareness one on. Alright, now you're gonna come here to this side and you can save it as a job outfit. That way you have it and you can just, you know, put it on. Let me know when you've done that.
Do masks sometimes not come off to you?
Huh?
Oh, never mind. There we go.
Alright, now you're gonna come follow me. So this is our staff room. Got a nice little table over here with the fake grass. This is where I go when they say to touch grass.
Okay.
That was a joke. Anyway, okay, so there's gonna be some times when people keep walking because keep walking. People are going to you're gonna come over here.
Not meant for you to sell. Come on.
Pass by us, right? They're gonna pass by us and come into here. That's because right here is plastic surgery. They come in this room, you leave them alone.
I see.
We'll go upstairs later. I'm gonna show you triage. We have a bathroom here if you ever need to use the restroom. Right here is OR1, which is an active surgery in. Over here, there's OR2, which
Very nice OR.
there's windows here, so if somebody feels more comfortable not being like in a more private area.
Echo 54, we're gonna be code 4 on the pier. Back available, heading back to pillbox.
They can use these beds.
Oh, nice. Is grabbing somebody something? Oh, okay. Is it the same thing I would know?
Where I meant to do. I'll pull my gun.
Maybe not.
To be straight with you, I don't know how to grab people other than through the duty belt. Which the duty belt is your Z muscle.
I told you he can't drive.
And you don't have to hold it, you can just tap it. And then you'll go to job and escort. And you'll do the same to let them go.
Oh, okay.
You wanna try that on me? Okay, and then, yep. Then you can do the same. Now, the thing about this is you always want to have Nancy take the patient off of the bed before you move them. Otherwise, you'll break the bed or the patient, or both.
Oh, okay. Yeah, I understand that.
This is triage. This is where people come in and get their treatment. You know.
Does EMS give like triage colors?
Not really. They just say critical, not critical. I'll give you a rundown.
That's easy.
This is our ICU ward. Over here, we have our private rooms. We have room 108 and 109, which are our private rooms. And then over on the right here, if Ivan passed out here. Okay, this is room 110. And it goes, so when they ask what bed the patient is in, 1 is all the way at the end, always starting from the door. 1, 2, or from the wall. 1, 2, 3.
Okay.
Over here, room 111. On the wall, 1, 2, 3. 3 is always the one closest to the door.
Okay. Makes sense.
This is the room that I take people to do diagnostics and, you know, checkups and everything. Due to the sole factor that the other one is where plastic surgery is, and I don't want people interrupting.
Just more privacy and all that.
Mm-hmm. Here's a little reception desk that doesn't actually do anything. They just... Nancy likes to watch over people here. Alright, let's go through... you were in the office earlier. That was the office. So it's our chief director, you know, all their office. You're gonna look at the... You've been here before, but you're gonna look at the elevator. Go to floor 1. Went from secure to not secure.
I
Door
noticed.
always stays unlocked. Their little reception desk. We never have anybody down here. Mainly because this is the 95s area. Whenever we have patients, we bring them, 95 patients, they bring them down here. Or officers will come down here. We'll treat them.
So like upstairs is the non-95 area.
Yep, and we have a 95 surgery room as well. Over here,
That's cool.
this is the garage that you've seen. You've been here.
I've seen the garage, yes.
Do not park in those because Ambo's parked there.
Oh, of course. Of course.
That was a test and you succeeded. Alright, so these doors slide open.
Just out of practice doesn't mean I can't. I don't remember.
You can place somebody in the bed.
Okay.
Like these, I just wish they had locks.
Yeah.
But that's okay. Now your favorite area. The
Nice.
lab.
Much more comprehensive, which is nice.
It's your favorite area too.
It is.
Yeah, I was thinking about having the lab come here as well, but this is the morgue. Knock knock. Any bodies want to scream at me? No. Okay, good. We have technically 4 beds. We have 1, 2, 3, and the blue one over there.
Okay. Not really my deal, but
It can be cross-trained to do ME stuff though. Out to the roof. It'll be floor 11. Because apparently we'd never have access to floor 3 through 10. Like
it's like
administrative.
spare rooms probably.
It's the shelter. This is our roof.
Nice.
Lovely roof. So if there's anybody who's coming in, clear the helipad. We sit in the area there and wait for them to fully land before we. I like to just chill on this bed when I'm trying to do paperwork. Nobody's bothering me.
Paperwork stick.
Yes, yes. Back to floor 3. Alrighty. There's one more room to show you. Well, two more rooms. We have the MRI and X-ray room.
Oh, fancy.
And you can lay on the bed.
Oh, finally. Nice.
Same with the MRI bed. Let me see this because they just fixed this. Yay! Yay! Okay. I'm gonna be straight with you. You wanna know what it looked like beforehand? People will go on the bed like this. So I'm glad that they no longer go on the bed like that. Perfect place.
Yeah, fair enough.
And one last room.
Echo 96, back 1041.
Storage room.
Is there a
Or
bed
the ER
to
closet.
hide in? Is it a
And
bed to hide in?
you can lay in this bed.
Is it just to
You
hide
know what?
in?
Just because you say that, I'm gonna take the lollipop off the stick. It's gonna become a candy.
What?
Whoa.
Who
Except
just
for
made a
the lollipops
monstrosity
off
of
the
a... was that Dallas? It's a monstrosity. Take the candy off the lollipop stick. How dare. Anyway, right. Now I'm gonna bring you over here. So, because you're so far behind me, I don't know if you can hear me whispering.
I can.
So this, we're not gonna go in, but this is Sally and Jax. When they are working, they'll be open every so often when they're working. You could come here, buy food from them if you want. They are an actual working business.
Nice.
Now, it's time for your equipment. Make sure you lock these doors. These doors stay locked. Now over here, you're going to come in here and you're going to buy, and you're not actually paying money, but buy bandages and first aid kits. You cannot like pull them over and stack them. So I always buy 15, and then anything I don't use, I just give to one of the EMS because they're bound to use it. And then you always want one radio. Speaking of, go ahead and buy a radio.
How
Just
many
one.
painkillers do you recommend getting?
Oh, I don't grab those.
Oh, okay. Yeah, I didn't get any summer.
Alexis, you all good?
Okay,
Okay.
you grabbed a radio and
I did.
bandages and first aid kits.
Okay. Yep.
What I just sent you in the email, you're gonna press that muscle. So it's right above your enter on the radio. And you'll get the radio open.
Oh, I see.
Now what you're gonna do, I'm gonna have you connect to Sam's 1. You're just gonna go scroll down to Sam's 1 and click little person. There you go.
Okay.
Now on the top it says volume, then call sign. I need you to put your call sign in there. Make sure your call sign's Echo 20. Make sure you have the dash. There you go.
Okay.
Alright, do you remember call sign, or do you remember your clock in and clock out type radio comms?
41, 42.
You want to go ahead and call yourself on duty?
Is it to talk on the radio?
Yours is custom. Or mine is custom. So if you just look in your...
Here, you can have the lollipop. Bye.
Yeah, mine's custom. So... Hold on.
Echo 18 from Echo 14.
Send it.
What's your 20?
I am just setting to 19.
10-4.
Okay.
Got it?
E21 41.
Echo.
Welcome aboard!
Oh, it's Echo. Oh, I forgot. So
You're good. You're good. It's bound to happen at some point, so kind of fully expected it.
I'm also not like an EMS by training, so
Yeah, I mean, your E is just for the emergency part.
Echo 4, Echo 14.
I'm right behind you.
Alright. So, come here. I need you to jump. I need you to jump, Cookie. There you go.
I hate doors.
Jesus
Yeah.
Chrysalis.
Mom, your pants.
What?
They're not purple.
Oh, my pant. Yeah.
Dallas,
Huh? Yeah?
come with me.
Huh?
I am going to use you as a little dummy.
Oh boy.
I'm gonna need him to
Echo 54
learn
plus
how
1. We're gonna go
to,
do a welfare check at the Fox
give
Den. We'll be
somebody-
10-8 on patrol.
you know, a bandage and everything. I'm gonna use you for that.
I'm about to get punched in the face, aren't I?
Yeah.
Alright, at least put me in recovery first.
Echo 4-5 to dispatch. In case of...
Cookie, you're gonna have to step away.
Hold on. Hold on.
We're science experimenting. I
Okay.
guess.
Okay.
Oh.
So first thing we're gonna try. How much did that hurt?
Like 21%. Ow.
Okay.
my
I have a punch, okay? Alright, so what you're gonna do, if you want to sit on the bed, you can. Whenever somebody comes in injured, I always instruct them to not lay in the bed, but to sit on it. Or to lay on
Oh.
top of it. Because if they
That's
You
lay,
could also.
That's a change of habit.
if they lay in the bed, like, if they look at the bed and they lay in it, you cannot give them a bandage.
Yeah. I'm just
Kinda
relaxing
like-
on top of the bed.
Oh, okay. That's
So-
a change of habit.
Yes. So, you're going to go ahead and you remember the duty belt that I showed you?
Yep.
Okay, you're gonna go to the job and you're gonna heal up his wounds. But I would just go ahead and check on, you know, do everything you would do with checking on a patient. Because he did just get punched. Do your little spiel. Make sure he's okay before you just give him a nice peck.
I'm not okay.
Okay. Well, let's see what happens.
Because
Oh
Sorry.
my gosh.
The
I'm like,
little
just
blueberry has a mean right hook.
I'm sorry.
Can you believe that a day ago I was
I'm
training
just
her and
gonna
now she's
apply
punching me in
that
the
there.
Yeah. Oh, that actually feels nice.
Open a
I don't think I've ever had
them.
Namiku. That's
When
what
I
I've been
get to
doing to people?
experience it. Basically.
It's like
Look
getting
at this.
tased for your first time. You gotta do it before you can start taste people.
Do you want an ice pack?
Yes,
hold it
please.
there. Okay.
No, I just want to live with this black eye for the rest of my life.
There you go. Just crack it there. There you go. Activate it. There you go.
Echo 4,
Usually
Echo
it's
18 direct.
Usually it's
No.
at the point
Can
that
you
you're
meet us
giving
in
them
the
the
office,
ice pack
please?
that you're helping them feel all the better.
There we go. Just gonna give you an ice pack there.
We
Nice.
You
I'm
okay?
Dallas, by the way. You're in. Yeah. I'm great.
Justin.
All right, I'm not gonna down you, but the
Nice to
same
meet you.
way.
Echo
The
37
same
from
way.
Echo 14.
Radio.
Could you meet me in the office, please?
So many office visits. The same way that you would heal, the
Mhm.
wounds, right? You can, get them back up on their feet, but you're still gonna have to, heal their wounds. So if they're like fully down and needing EMS medical to actually get them up on their feet, you'll, revive them to their feet, and then afterwards don't forget to give them a final bandage, because they will still feel kind of crummy until you do.
One of those things.
Yeah.
I understand.
All right. Is there any questions so far?
Nope. All relatively straightforward.
Okay. So we got your onboarding done. How much time do you think you have left?
Probably like less than 10 minutes.
Okay. Onboarding is done. Tomorrow I'm doing stuff with my family. But afterwards
I probably
if
won't
you-
be around until the weekend or something.
Fair enough. Okay. Then we will see.
I'll just let you know about that.
Okay. Yeah, go ahead and email me when you do.
Yeah. That's just probably easiest right now.
Yeah, 100%. Alright, well, if you want to go ahead and clock off duty, do the same way you clocked on duty with the radio. And then do not forget to get off radio.
Yeah. Makes
Oh,
sense.
yeah, that's right. I forgot to show you. We do have lockers. Let me show you those.
Yeah, that's actually also did you show them the fridge, I assume?
Yes.
Where do reports go?
Reports?
In your MDT?
Yeah, your MDT.
We don't have time to go through the whole MDT if you only have 10
Yeah,
minutes. I don't think.
that's why I was asking you how much time you had left.
Oh, yeah, we can cover that another time.
Yeah.
Just don't forget to ask, because for doctor stuff, it's very important.
Yeah, fun fact,
yeah.
I was here at the beginning when I was never taught the MDT or ICU or anything. I just kind of learned it myself and figured it out over myself by me having a fellow medical personnel needing to be put in the ICU while I have people radioing me because I was the only doctor for stuff going downstairs. I'm like, guys, I don't even know how to put this person in ICU. So, but we figured it out. Okay, lockers right here. You're gonna open your locker.
You gotta
your
kind of
personal locker.
thread the needle between
Yeah, I figured
looking
it out.
at the changing room and the clothing store.
So, yeah. Don't forget to clock off on radio.
It's 42 instead of 41.
Yeah.
He knows.
Yep.
I'm
I
sh-
know.
Yeah. All right.
Echo 21 to 42.
10 for thank you for your service.
Thank you for your service. Have a good night.
All
Have a
right.
good night.
You can go ahead and get out of uniform. You remember the way you go into the radio? You're gonna do the same. I'll just wait till you're out of uniform, though.
I think they fixed the thing where even if you are off duty, you could still access radio. I think they fixed it. But probably good habit to just leave it.
Are you good, Cookie? There you are. Don't forget to. You gotta like. Yep.
All right, there we go.
All right. Now, same way you went into radio the first time. Go ahead and on the top left is gonna be a little power button. Just power it down.
Oh, nice.
There you go. And then you can put your radio in there. Any bandages, stuff like that, you can just give to the
usual
EMS out
stuff.
there.
Me too.
That's what I do. I give
Okay.
it to the medical staff out there.
Okay. Cool.
And we will see you again. Just with your MDT, it's /MDT, or I have a quick button
Just-
for it.
Yeah.
Which I can run you through that real quick. Are you still clocked in?
Yes, I am.
Okay. So you have your dashboard, which is, you know, where the online the on wow. On MDT doctors. There you go. So that doesn't necessarily mean people who are on duty. It's people who just happen to have their MDT.
Echo 14 dispatch, please welcome and congratulate Natalie on her promotion to being a paramedic.
Congratulations.
Congratulations.
Okay.
Congrats. Good job.
Okay. So we have that. That is like all the people who are either awake, and on duty or just awake. Then we have incidents, which is where you will. We'll teach you this later, but it's where you'll go through old incident reports or create new incident reports with, you know, your name as being the doctor, the victim, and then
Doesn't seem so
little
bad
TLDR.
report-wise.
It's not that hard. Doctors is literally just the same thing as dashboard, honestly. It just
Yeah, that doesn't seem too bad as.
Mhm.
Yeah, that doesn't seem really too bad.
the doctors tab literally tells you, you know, paramedic, chief of EMS, resident doctor. It splits it up. Now it's incorrect right now because I'm still considered a resident doctor. Me and Lena are not resident
Control plus
doctors,
rumble route.
but it's not a tag yet. They're still trying to
Okay.
work on it. We're
Fair
senior
enough.
doctors. Citizens, that's how you will look up people's names and their information. I would suggest once you get a chance, go through and update your profile with emergency contacts and stuff. Codes, pretty much just if you need to.
Emergency contacts, Arabella would be the only one.
Yeah. But
Pretty
still.
much, I would say. Yeah.
Any allergies, any medical history, stuff like that, or the fact that you want to be a organ donor or not, put that on. You have codes, which is just the 10 codes we use here, just not a lot. Announcements hasn't been used for 2 months, but keep an eye on that in case I change it. And then configuration, you can change up the color of your MDT if you want.
Oh, nice.
I just realized it changed colors on me. Mine was purple. you go. It's purple now.
EMS here, clear development.
Down 4.
Alright, you are all good on that. We'll explain the report writing and ICU stuff the next
Echo
time you're
54
around.
plus 1 on scene.
Sounds good to me.
Congratulations, Natalie.
Thank you,
Go-
miss.
Go ahead and go on your phone. And you know the
Yep.
services app. Go ahead and clock off.
Nice. Cool.
Alright. Perfect. Alright, well, we'll see you.
You did great.
I'm supposed to be saying that to you.
Wow, I should say it to you because who
Because
knows?
you trained me and now I'm training you and I've definitely improved. Yes, 100%.
Echo
Isn't that
51
funny how
going
it is?
41.
10-4, welcome aboard.
I was going 41, not 42. Wait, did I say 41?
Yes.
Wait, I meant 42.
Echo 51 going
Oops.
42.
That's why I'm going
For your
42.
service. For thank you for your service. Have a good night.
That is why I'm going 42. I am that fucking tired. Oh my god.
That's why I said 10-4, welcome aboard the way I did. I was waiting for you to pick it up.
I'm Piper, by the way. I don't think we've met.
Hi, I'm Senior Dr. Arabella Romanoff. Nice to meet you.
Nice to meet you.
Yes. All right, Cookie.
I'm Justin. Hello.
Cookie.
Hello, Piper.
He's
Nice to
also
meet you.
Cookie. If you hear me say Cookie, it's him.
Okay.
Oh gosh, that is gonna get around.
Yeah, I can't not call you
Oh,
Cookie. I am
I know you
sorry. I
can't.
can't not
Oh,
call you Cookie. I've
no.
called you Cookie for years.
That's okay. I know
I'll
you
try
can't.
not to call you that.
That
But
you
the more
are
I hear it, the
good.
more it might happen. I apologize.
That's all right if you. do.
Okay.
Don't
You
mind.
know where we had, lower pillbox where, you're going through the garage and everything.
Yeah.
You park your personal vehicle down there.
Oh, okay. Cool.
Speaking of which, you should probably make sure your personal vehicle is still here.
I should. All right, well, see you later.
Mhm. Echo 46 is back 10-8. Not me almost forgetting my own call sign. Phew, and now there's one.
Yeah, I was just going with him, man. Shit. Hold on, let me go grab his ass.
Said I could help him, and then he just disappears.
I fell asleep knowing him.
Yeah, maybe he's got special powers, man.
He probably does. How y'all doing today?
Doing good, how are you?
Surviving.
Fair enough, fair enough. What happened?
Oh, I slammed the bitch. Come on, you are.
Happened.
Echo.
I fell off my ATV.
Have a good night.
Clear
Ten
service,
five,
have a
good
good
night.
night.
Wait, hold on. Y'all say 10-5 good night?
10-4, have a good night.
Oh, okay. At least at 10-5, I was like, what?
No. Okay, I definitely see some red ash on your elbows here, so I'm gonna go ahead and clean those up with some saline. It's gonna be a little cold here.
Yes, ma'am. Sorry, I got water in my nose. Oh my god. Okay, I'm back. I'm good. Sorry.
What to say? And your elbows, it is splashing
No,
your nose.
I got water in my nose.
Oh, okay. Alright, I'm gonna do some antibiotic
Um,
ointment. Then bandage on those
appreciate it.
elbows, my dear.
Hey, you wow.
How's that?
That feels so much better, honestly. I thought I was getting infected or something on my elbows, and that doesn't sound like it'd be good at all. So.
Well, you should be all good as semi-new.
Well, thank you, man.
Yeah, no problem. See if your other friend still needs assistance. Did any of you guys need any
There
assistance?
might be. Actually, if you
Mm-mm.
go back there, I think there might be a brain cell back
Oh,
there.
shit.
It's like
I
on the
was
copy.
gonna say.
Are we still on with this brain cell thing?
Where is it?
Yes! I need it!
You had it! How did you already lose it?
They did. They had it for a second.
Right there.
Where?
I swear.
Where?
I was like, where the fuck?
Alright. Let's go,
You good to
young.
Alright, you guys have a good one.
Thank you.
Someone up there. Also, I accidentally tapped it. I was gonna give you some money
Rose,
for
what the
repair.
heck?
That's my way. I'm good though. I don't make money from taps, so no offense.
You sure, Eli? Oh, whoops, sorry, guys.
I'll be fine. I'll be fine. Yeah,
All
I'm
right.
good.
Yeah, I don't know how I hit it,
How
but you know,
are
I got
you?
it pretty good, so I was gonna.
What the hell did you do?
I got tackled by a suspect and started bleeding after a car accident, and I went down pretty fast.
Yeah,
It's
definitely not in
fine.
here. I'm disappointed.
You were searching for it in the closet?
What are they
I got told there's a brain
That's
cell
the
in there,
last
okay?
brain cell.
I don't think it's in
So
there.
it doesn't exist.
Is that because you took it, Rose?
No, I never had it.
You never had it?
At this rate, Rose would be
Are
lucky
you
if she had
sure?
half of one. I'd be lucky if I even have a quarter of one.
Okay, go ahead and look over your injuries, my dear.
Thanks.
Yeah, no problem.
No getting hurt.
I've already been shot
Not-
once today.
I know.
She has.
Don't-
No,
I
not
vividly
allowed.
remember that.
I've been shot
I
3
will
days
say
in a
we,
row.
we did amazing.
Yeah, you're
on
crashing
that
out
one.
about it.
Yeah, I was. I'm no longer crashing out about it.
Hell
Yeah,
yeah.
no.
I'm proud of you.
Hey.
If I'm not allowed to get shot, you're not allowed to get shot.
You're
I've been
not
shot
allowed
a
to get
lot.
shot because you have an EMS for a girlfriend, and she will literally ground you to the room.
It's Broge.
Yep, Southside. EMS call. Hooray.
Alright, let's go.
Yeah, that's you probably gonna want PD for that one.
Yeah, it is Broke Street.
I got 54 plus 1 and on to the latest medical.
Yeah, that
Alrighty,
sounds
how's
like a
that
fun
feel, my
time.
dear?
Thank yous. I feel better.
You're welcome. You have pink handcuffs.
Bye. I do. Bye.
Are they fuzzy?
Babe, you don't have pink handcuffs. How dare?
That vest has a taser on it. I already have a taser on my belt.
But you don't have pink handcuffs.
I mean, I do have them, just not on my vest when I'm in uniform.
How about purple?
Those are not available.
Damn it.
I might be able to paint the pink ones I have.
Hello again.
Hi. I was just talking to the cop.
I'm gonna go ahead and clean you up here because it's you. Yeah, poor you. Did you feel or hear anything snap, crackle, pop like our Ice Krispy treat, or feel any numbness or tingling in your neck, back, or any of your extremities?
And no, I rolled. I got mostly some cuts and scrapes, some road rash.
Okay. Well, I was able to clean those up for you, my dear. How's that feel, by the way?
I'm feeling better. I'm gonna be sore tomorrow, but
Yeah, a little bit.
that's
but-
tough. Yeah, and don't tell Lexi about it.
I mean, don't really have a need to.
Yeah, yeah. She taking notes?
I don't know what you're talking about.
Hmm. Okay, well, you guys stay safe. Have a good shift.
Thank you. I've been here
All right.
not too long.
Yeah.
Yeah, I've been here long enough to stand in on an interview and do some onboarding for someone. That's about all.
Very nice. Very nice.
Yes.
Well, maybe you'll be supervised soon enough.
Probably. But I can take
Backup
my time.
14,
I just want
16, latest medical at Crystal
I
Lane.
just want to have the proper title of senior doctor to show up and not resident. That's all I'm waiting for.
Yeah. No,
EMSPD.
Send it.
Hey, I got a guy with a black eye. Doesn't appear to be Conquest at LSC. We got someone making.
Thank you again.
Yeah, we are 76 currently.
Cool.
Thank you. See you shortly.
Alrighty, we'll go ahead and come back here. Did you have any nice tingling, dizziness, anything like that?
No, I just have a bit of pain and a sore jaw.
Fair enough. Did you hear your jaw pop when you open your mouth and close it? Does it get more pull, or is it just more tender?
Just more tender.
Okay.
It hurts sort of when I wiggle it, but you know, it's just my face, and I wiggle it when I talk.
I mean, you're gonna have some pretty decent bruising there on your jawbone, so the wiggling might be a little painful, but...
Oh god, I gotta shut up then.
No, just careful with yawning. Alright, how's that feel?
No, that feels wonderful. Thank you very much. Appreciate that.
Yeah, no problem.
How you guys been going here? How's the EMS going?
It's been good.
Oh, that's
Been
good.
a couple cross-trained and a couple newbies.
Oh, that's good. You know, like to check and see how you guys are going, you know. You help us a lot, you know, you take the bullets and the blades out of us, so.
Sometimes the bullets.
Yeah. I've had a few taken out from me.
Or, you know, taking them, but...
Mm.
Oh, salutations, doctor. What are they?
No.
Hello.
Hi, can I help you, my dear?
I do need an ice bag, and I think her stitch need to be checked. What are they?
Okay, both
It's
of you
fine.
guys.
They just said to pour bottled water on it.
I still want you to check.
No. Do not do that. You both are coming with me.
Hi, Simon.
Okay, we are not pouring bottled water on it.
You see, when you were like really worried about me with my fucking head, that was nothing. This is something. What are they?
No, it was literally your brain. You had brain swelling. That was something.
That's something.
Listen.
That is definitely something. Brain swelling is something
PDD
you don't
admits.
mess with.
Go to the PD.
We're gonna be on Strawberry Ave with that down
who's first?
civilian.
You.
Actually, no, miss.
Stand by. There is
okay.
a
Okay,
vehicle
I'm less
that matches
important.
the
I
description of
understand.
who he
Yeah.
No,
said
you're
was
less.
trying to mess with him. Maybe stay
sorry,
nearby until
radio's
we know. For sure.
Okay, yeah, that's true.
Alright, I'm gonna go ahead and clean up your cuts and scrapes and give you a little bit of a nice package.
Thank you. What are they? Thank you. Thank you. Oh, I feel so much better. It feels so much good.
Yeah. Alright, and how about
I don't
you,
think my left foot is supposed. I don't think my right foot's supposed to be twisted like that.
Nah, it should
It's
be
just the
fine.
bed.
Okay, my shoe just came loose. That's for sure.
100%.
They took my spleen out a few days ago. It wasn't cute. It had been kind of battered and bruised. And so they took it out And then they said, don't get in any water. If you go in the ocean, it'll sting like a bitch. And then I said, what about a chlorinated pool? They said, nope, that'll also sting like a bitch. But if you do
EMS, go ahead
accidentally
and
take a
roll in
little spill in
on
some water,
Strawberry.
you should just, you know,
10,
like,
formal
use some
rolling.
fresh water,
Thank you.
or you know, like rinse it off with like water from like a water bottle. Is what they said. But I only need to have these stitches. Like, I think it'll be fully healed in like a day or two. I've been getting several checkups on it. I've been very good and very disciplined about coming back to the hospital. Yeah.
If you continue to do that, you're getting out of here. Okay.
Echo 54 +1 on scene.
I go ahead and look over these sutures for any kind of inflammation, discoloration, any signs of infection. I'm also going to go ahead and clean them off as well. Okay, you have some minor redness, probably irritation from the
chlorine.
Chlorine, yep.
I was only in there for like a second.
Yeah, but the chlorine with your fresh, you know, your sutures and stuff before they're actually finalized is going to cause
Yeah.
irritation. So I went ahead and I cleaned it off. I applied some betadine, which is a antibiotic ointment, and then applied a fresh layer of gauze bandages above it as well. Make sure to keep those dry. And the redness should go down a couple of hours.
Right. And what was your name?
I am Senior Dr. Arabella Romanoff. Nice to meet you.
It's nice to meet you too.
Alright. And you should be all good, my dear. Is there anything else I can help you with?
No. That's it.
Perfect.
We're gonna go bowling.
Check on them. Yeah, be careful with those sutures.
Will do.
Take a
Thank you.
lighter
Will do.
bowling ball.
Okay.
your shift earlier?
Hello.
Hello.
What happened?
My
His
arm.
forearm.
I'll let her tell you.
Forearm.
Hold
GSW
on,
through.
hold on 1 second. I'm gonna need you to get out of the bed so I can actually treat you, my dear.
Yeah, you're fine.
So you don't bleed out on me while we're trying to figure this out.
Oh no, this is an old thing.
Yeah, it's a day or two old forearm GSW that was angy and infected. He's on antibiotics currently for it, but he said it was itching, so I wanted him to get it looked at.
If I see you itch, I bap hand. Nope, itchy.
Yes, Doc.
You listen to her better than you listen to me.
I mean, I listen to you. I just don't feel like getting bapped.
I feel like I didn't bap you earlier today.
Just starting to bap him again. It'll work, apparently.
Echo 46 from 54.
Send it.
Hey, we're gonna have a gunshot victim come in here shortly to you if you want to prep.
Currently with a patient at the moment.
Hi,
Careful.
Alex.
Uh-oh. Motor unit down! Motor unit down!
Hughes, what happened now?
He wrecked like 4 times in a pursuit.
Again?
Yeah, like 4 fucking times. It was really funny to watch.
I feel like you need bubble wrap.
I don't think
No, that's for Bauer.
Yeah, that's Bauer.
Ah,
yeah,
son of a
I'm not
bitch.
taking Bauer's bit.
What kind of antibiotics are you on?
Vancomycin.
Perfect. Okay, I don't need to change that then. So it is getting red. and a
Dylan,
bit
you should
inflamed.
probably
I would
lay down.
definitely be more cautious with it. I did some cleanup of the area,
I
put
just
some
found like 3
betadine.
stories off my bike.
Gonna go ahead and put a bandage on it. I would say
Oh my gosh. You what now?
I was trying. I was
you're
going
taking
like
that
130,
vancomycin. I would say get
and I hit a
regular
I hit a lamppost,
cleanings probably a couple of hours with the saline. I know you are able to do that, my dear.
Yeah. He's a cop, so he won't do that.
I hit a
I was
lamp
saying you.
at like
Oh yeah, I do, but that requires him to actually slow down and come off duty, or at least stop by the hospital for that to be done.
I stopped in. I stopped in.
Well,
At
you
the
stopped
beginning or at
in.
the end of
gotta
your
be
shift, which is
careful.
like what,
I don't know
6,
how I didn't
7
die.
hours long?
Today, yeah.
I'm looking for
Mhm.
his
Yesterday
helmet
was
saved my
14.
life.
Yeah, point in case.
That helmet did.
Look,
save
if you
life.
tell me I need to come in and do it, I'll come in and do it.
Yeah, you need a new helmet.
Yeah. Oh, jeez.
Do you mind if we actually do a blood lab, run a CBC, and check his white count? Because that's been red and puffy for a day or two.
Then, sorry, I was in my head for a second there. Had to make sure something was okay. All right, what?
I was asking if you mind doing blood work, do a CBC to check his white count.
Oh, I'm going to. I just needed to clean it
Beautiful,
off and
beautiful.
everything. I also want to
Yeah.
make sure that Dylan stops falling down. So I'm gonna
Yeah, that's a good
go
thing,
ahead and
Go
give
take
him
care of
that.
him.
Yeah, and then I'll be right back.
Don't look at me. I'm a failure.
What happened? You got
I fell off
some
my bike 5 times in the past
Rush-
20
Did
minutes.
you feel or hear anything snap, crackle, pop like a Rice Krispie, and or do you have any numbness, tingling in your neck, back, or
I could
any of
go
your
for some Rice
extremities?
Krispies. Nothing more than normal.
Nothing.
His
What's
helmet
normal?
appears to.
When I breathe in, sometimes there's a bit of crackling, but Kia and Benji said it was okay because it's healing.
Echo 54+1 and round to Pillbox Hill with 1
His helmet
critical.
appears to have a rather large
How's that feel,
Also,
crack in it.
I feel thank you so much. Also, so I brought this theory to Benji and Kia earlier and Scarlett, and they laughed at me. But you know how, like in the wild, where you got zebras and giraffes and buffaloes and all of
I
these other
hate that you call the
animals?
zebra a zebra.
It's a zebra. It's with the Z's. Anyway,
zebra.
that's another point. You know how when they're being hunted by like the lions and the coyotes and all of the other wild dogs
Yes.
and animals, you know how the lions they attack the weakest one in the herd, right?
Yes.
It's just the easiest target. So does that? I had the theory, and I still have the theory, even though Kia and Benji told me it's not right. I have the theory that when you hit your head, it kills off the weak brain cells, the dying brain cells, and then it
Echo
leaves the strong ones to
123
the
upper
left.
Pillbox with 1 critical.
You can add
So
me to the people who
realistically,
laughed at that.
So realistically, every time that I hit my head, I'm actually doing myself good because I'm killing off the dead brain cells and killing off the weak brain cells that we're meant to live, right?
Dylan, I'm gonna get
Does-
you a new helmet.
Does Lexi need to
Alright.
find?
Hi, welcome back. Is
It's
it
not-
relevant
I
that I
mean,
had
Find your brain
fairly
cell.
decent
No one's told
surgery
me I'm
yesterday?
wrong. I mean, except
I'm
for
sorry.
Kia and Benji
Dylan,
and
can you keep your voice down, my dear?
sorry.
Say it one more time.
Is it relevant that I had surgery yesterday?
I mean, that's not
Dylan,
going to
did you
really
get hurt
affect your
again?
white count. Your white count only gets affected if you have active infection.
Oh.
So
That
unless
was-
you're like rubbing sewage or dirt in your wounds or some shit, then they.
I mean, I did have to jump in the canals earlier, but
Did you clean your bandages?
yes, I cleaned and swapped my bandages after I had to get in the nasty ass canal water.
Did you flush everything?
I used whatever I had. I grabbed whatever saline I have in my med bag in the back of the car.
Alright.
You think? I know
Yeah,
some
I
med
don't.
stuff.
I don't care what you know. You know just like I do. When you get in the moment chasing somebody, you tunnel vision sometimes.
Yeah, I have to take care of what I have to take care of. I'll clean it
I
after.
know, which means you're not thinking about you, which is why I ask these things.
We'll
Yes,
clean it
I-
after. So hold on. How long after?
Thank you
What do you mean?
much.
You said I do what I gotta do, then I'll clean it after. So how long
It was
after
like
are you waiting?
30 minutes, I
Okay.
think.
Okay.
30, 45 minutes.
That's a lot of time to get an infection.
Good night, you guys.
Didn't have time.
Okay. Well, I'm gonna look for a good vein here. See if I can find one. So I can get some blood drawn.
Yeah, you're fine. I apparently have very easy to find veins, so. Also, rude Alex didn't even say hi. That's fucked up.
I get an ice buck, you're dealing with someone.
She's not paying any attention to me.
What, you're bitching about Alex not saying hi to you?
Yeah, I was giving her shit.
Don't worry, I
She
give my
didn't hear me,
girlfriend shit
though.
all the time.
I give her shit all the time.
Yep.
That's the fun part about being friends.
Babe,
Can't believe you
stop
wouldn't say hi to
ignoring
me.
him.
She got banged up by the ATV.
I thought we was homies, Alex. What the fuck?
I was like just out of earshot. What were you saying about giving me shit all the time?
Said
That
I give you
was-
shit at work.
Oh,
Wait,
yeah.
Alright, I'm just gonna make sure there's no bleeding or like good cods. I'll clean them up if there are.
I'm getting blood taken.
Oh, fun.
Hey, I didn't get shot today.
That's good.
I'm like one of Rose is beating me now because she got shot at the whole. Were you on duty when the garage thing happened?
The garage thing?
Yeah, with Red.
Bingo.
Tasting the rainbow today?
Yeah.
Wonderful.
Like every day. It always pinches.
Yep. Alrighty. That is removed. I'm gonna go ahead and run these down to the lab, and then I'll be right back.
Okie dokie. I'll stay here.
Hello, you need some medical attention?
Yes.
What happened?
Happy
EMS from PD, just so that you know, we are currently en route to the latest medical in Air 1.
10-4, you might get there before us. We've got patients in the recovery room.
10-4.
If you want to send me the results after, thank you. Happy, happy, buried all your children. Tell me what I say.
Came in and got it looked at.
Alright. I'm gonna numb you up with
After
some
I had
lidocaine
surgery to get a bullet out of my thigh.
Clean this off. That way it
And what
doesn't
was your
burn
name,
too
my
much
dear?
when I'm cleaning it because I gotta
Eric
kinda
Burns.
get the saline in there a little bit and clean it out
Sweet
real
old
good.
dipshit.
Love you too, Lyra. I'm gonna tell Kennedy you're mean to me.
You can tell Kennedy that all you want. You think I give two shits what the fuck she has to say?
She'll tell
She'll
you be nice to
probably
me.
jump on the bandwagon and start harassing you.
Alright.
No, she'll tell you be nice to me.
These stitches on your arm,
Actually,
okay?
you know what? Here, I'll tell her. I'll tell her so she'll start harassing you.
Yeah, do it. See if she won't side with me.
Okay, so you're on vancomycin and erythromycin.
762, latest with
I have no idea what that means.
They're both
Here's
antibiotics.
number one. If
Okay.
oh, it might
sure the
sting a little. It
erythromycin
shouldn't be too
was
bad
a
because I got you
script
numbed up with some
post-op?
lidocaine, okay?
Vancomycin?
I was only
No,
given
the
one
vancomycin
script by
is,
her.
I did the vancomycin. The what'd you say? Erythromycin?
Yes.
Are you sure
I-
that was a script given
No,
post-op?
no. I'm saying that was what you were given for the what he was given for the surgery.
Ah, gotcha.
I was unconscious. I don't know what
There we
you're
go. I
talking
guess I
about.
just needed to wait a
It's
little
not
bit
your
longer
job
for
to know meds. You're good.
Yeah,
No,
you were,
it's my job to shoot bad guys.
Yeah.
So you were on two different
Oh, yeah.
I apologize
antibiotics.
about that. Would you like some ibuprofen or anything?
Alright, we're waiting for the results to see what we're looking at, okay?
Okie dokie. Oh, that's annoying. Even though I
There you
talk
are.
about
Do you have anything to
video
drink
or
for that?
Still
Would
has
you like
me.
the water?
Yeah, I got
All right. Whenever you're ready and you feel good enough.
I'm gonna have to
Oh,
go to bed
God.
after this because I'm starting to get to a point where I'm getting sick.
Oh,
from
okay,
getting
okay.
up.
Oh yeah, but
Go ahead and take those whenever you're ready.
Sleep is important.
And watch your arm. Try to keep it clean. Don't let
It
it
happens
get
every
wet.
so often.
Keep bandages over it. Okay. I would say
Food,
change
water,
them about
meds.
every 4 hours for today, and then after today, you can change them about every day, just once a
But
day.
no, I'm sorry. I'm trying to hear you, but I'm also hearing behind me.
No problem.
You're
If you need
totally
anything, come back
fine.
and see us, okay?
No, I said food, water, meds. They're important.
Food, water, meds.
Yep.
What happened?
Why are you giving me a look? Why do I feel like you got a text that I'm not gonna like the answer to?
I'll tell you later.
Oh God.
Okay.
Yeah, my knees again, man.
Am I gonna get an angry ranting phone call later?
The what, 4th time today?
I don't
you
like that.
absolutely are, based on the sound of that.
I do not control my lovely little sister. She will do as she wants.
Who's your
Lovely
little
little-
sister?
No problem.
Sorry?
Who's your little sister?
Her name's Kennedy. She's not here. She's back home.
Yeah. Was my best friend growing up, and if this one pesters me about my medical crap, she's even worse.
Okay. I am still trying to look for results for this, so I'm just waiting for the labs to tell me when the results are in and what the results are on your white blood cell, which is if it's risen, usually means that it's trying to fight an infection. It does look like your white blood cell count is elevated, so it is trying to fight an infection.
You want Evis? You want to come down to the track? I've got the 47.
Radio.
Okay, 10-4. There's no real big good landing space for me to land on that.
Going on Sam's too. There's too much chatter. Alright. You have the vancomycin. We could do a mix of vancomycin and erythromycin to kind of fight it. I'm definitely seeing a mild, I'd say mild infection due to the number your white blood cell counts are on. Mild, but you are taking your vancomycin, correct?
Yeah, Lyra gave me some pill bottle. I've got it in my car right now. I can go get it if you want me to.
Alright, no, you're good. I'm gonna say take the vancomycin and erythromycin together with food.
Okay.
You sure you want to double it?
No. I'm looking at this, hold on. What, hold on, what, milligram is he on?
He's on 500 milligram.
Oh, hey, she does the tooth suck thing too. I know that noise. Usually when she makes that noise, it means she's mad at me for something.
Or something else.
So just come check in when I go off shift tomorrow.
That's just not a bad habit to get into with the injuries you seem to keep acquiring.
Just because I got shot 2 days in a row doesn't mean I'm going to accrue new injuries every day. Alex, back me up. We get shot. It's part of the job.
Nobody's denying that. Your inability
girlfriend
to
is going to back
dodge.
you up.
Your inability to dodge flying projectiles at
Yeah,
you
let
is
me just-
highly diminished when you're already injured.
I didn't realize you knew how to dodge bullets, Lyra.
Fucking potato, you know what I'm trying to say? Stop sassing me.
Okay. Yeah, so I would say give it another 24 hours. If it does not get any better, we can see about switching you off of vancomycin. And for a stronger antibiotic, which I would have to look to.
Okay.
And you don't have any allergies, correct?
Not to my knowledge.
Okay.
Unless they magically fucking happened between last
They-
time I had a.
They can, actually. You can develop allergies throughout
Well,
your
that's
life.
fucking annoying.
Hi, welcome to my life. I have idiopathic mast cell activation syndrome, so I become allergic to anything at any given time. Or I can not become allergic to something at any given time. Because I was allergic to morphine and now I'm not. I was allergic to weed and now I'm not.
That sounds incredibly annoying and difficult to test for.
It is very annoying, and I have to come in for regular tests, which means regular blood tests. Yeah. But I also have the rarest blood type in the world. I have golden blood. So
Oh, she's
Are
like
you
Ichi.
really?
Yes.
Yeah, my partner has that.
Oh?
Yeah, Ichi.
So there's 3 of us then.
I don't know of anyone else that has it.
There is one other person I cannot divulge who.
Well, yeah, obviously.
Has it. I know for sure, because, yeah. So, you said Itchy? Is that the Ichiban person that was coming in here earlier on duty? Okay. So him, myself, and one other I know for sure have golden blood. But I'm
think
currently
Kia
receiving
was
stem
saying-
cell treatment, so I wouldn't even be able to donate blood. So, yeah. Yeah, so that's the regimen we're gonna go with. Give it 24 hours. If it doesn't get any better, we'll switch you off of vancomycin and find a stronger antibiotic that'll be more localized.
10-4. As long as you don't gotta start cutting anything again, I'm good.
Hopefully not.
Can I actually snag an ice pack from you? I accidentally got socked in the cheek earlier. Again, it happens once a day to me at the least. It's really annoying.
Well, same.
I appreciate you.
I got to purposefully punch a EMS.
Oh?
Well, I was training a new intern on how to, you know, give somebody a bandage. So I took the one who was bullying me during my cross training. I'm like, I'm gonna use you as a test dummy.
Karma!
Karma is a bitch because he's cross training to be a doctor.
That's freaking great.
So yes, but yeah, so we'll stick with that. But yeah. So I completely understand with the whole allergies thing though. I fucking hate my life half the time because yeah, it's like, oh, you're not
Totally
allergic to
understandable.
this, then it's like, oh, you're now gonna start reacting to it and almost die. Yeah.
Yeah, that sounds awful.
That's how I found out I was allergic to weed at the start. And then I wasn't allergic to weed all of a sudden. I don't know why I started. But yeah.
Am I good to get out of bed, Doc?
Yes. That's what I was saying.
Oh, okay. I have learned to be very clear with asking that question because it gets me yelled at when I get out of bed.
Fair enough, fair enough. Yeah, I'm a little bit of a rare bean. It's really annoying.
You're good. She takes any excuse to yell at me, so you know.
Yeah. I hate my body. I love my
Bruce,
body,
you
but I
still
hate my
think
body.
I need an excuse to yell at you? Come on now.
I mean, you find them. You don't really need them. You manifest them from the ether.
Okay, I'm gonna go and get out of uniform and clock off duty before I get dragged to do more stuff because I am not feeling it.
Have a good night.
You as well. We'll see you tomorrow.
Insert joke about. Go ahead.
We've got a special boy here who needs help.
You're gonna have to take him to the local doctor. I'm at a point where I'm about to pass the fuck out.
Okay.
I'm sorry.
Have a good night. Or night. I get.
Echo 46 is 1042. I'm sorry, Alexis. Have a good night, my dear.
Don't be sorry. I'm close behind you and I'm also expecting it. I'm used to this.
I was gonna stay on duty a lot longer, but I feel like I'm going to legitimately pass out, so.
If you take care of you, your health is the priority here, not mine.
Insert joke about you getting angry with me if I get up before you want me to.
Hmm? Why is my outfit not... Hair's just broken.